Hello, welcome back to Am I Neurodivergent, chapter 40 of 52. I'm Struan, late diagnosed ADHDer, so both autism and ADHD, and these videos are a look back at my discovery year, finding out I was neurodivergent after 40 odd years being undiagnosed and having no idea. Same caveat as always, not an expert, don't speak for the whole neurodivergent community, just my own lived experience. So last episode, these were supposed to be weekly. I'm very conscious I haven't done one for quite some time now. My 2024 went a bit off the rails and I had a bit of a big mental health wobble and massively reframed how I think about demand avoidance. It is most definitely a thing and can be really challenging and debilitating. But anyway, I'm back now. Thank you so much, by the way, to everyone who emailed me or left messages. I think the longer I left it, the more I kind of lost confidence that doing these videos were anything other than just an exercise in self-indulgence. Like, so many other people are doing similar things, but this is my experience, and I really want to get the remaining videos of this series done that I set myself the goal of doing. They kind of stopped being fun for me for a little bit, so I stopped, but I really want to get back to them, and it really meant a lot to me for people to say these videos have been useful for them, so thank you. Anyway, last episode I looked at the most common adult ADHD self-test, the ASRSV 1.1, and this week I want to stick with the ADHD aspects of neurodivergence and do a walkthrough of the DIVA 2.0 formal assessment that I had that led to my diagnosis of severe combined ADHD on top of the autism diagnosis I'd already received. DIVA is an acronym for the Diagnostic Interview for ADHD in Adults version 2, and I'll put a link to it in the description because it's essentially the script a psychiatrist will use with you, at least as an adult in the UK, for working out whether you're an undiagnosed ADHD adult or not, coming to a late diagnosis as an adult. There's a certain similarity to the last video, the ADHD self-test, and I touched on some of this, I think, in the first Understanding ADHD video I did about 6 episodes ago. But I wanted to go through the actual interview questions you'll be asked in a formal ADHD assessment for belt and braces to maybe help people understand and anticipate what you'll likely be asked in that formal assessment setting for adult ADHD. I also quite like the DIVA acronym. I feel like as ADHDers, we've probably quite often had DIVA strops, and if we were undiagnosed ADHDers most of our lives, we wouldn't really know why we had those strops and those struggles with emotional regulation. Well, this is maybe why, because we're ADHD, we can struggle with regulating ourselves, and the DIVA assessment may well help us finally piece all of that together. I'm slightly out of sequence with these now in terms of like kind of religiously tracking my discovery year. I didn't do my own formal ADHD assessment until later, but I want to kind of tie up this little ADHD specific sub-series and then get more onto co-occurring ADHD and autism again to close out, because all the latest research indicates that co-occurring ADHD and autism, like I have, is way more common than previously believed. So the DIVA 2.0 looks to explore and assess the presence of ADHD symptoms in both childhood and adulthood and track the lifelong persistence of ADHD characteristics and challenges. Basically, I guess, to assess you're not just kind of having a phase or have certain overlapping ADHD-like symptoms as a result of, say, a traumatic event at a certain time, which should be addressed differently if that's the case. ADHD, like autism, is a lifelong condition, a lifelong way of being and of processing information. It's not episodic or something you just experience every once in a while. Ahead of the formal assessment, there were a number of forms to fill in. There's a self-assessment, an assessment from someone who knew you and your behaviour as well as a child, and an assessment for someone who's known you and your behaviour as well as an adult, as the clinical assessment itself follows this pattern of looking at and discussing both current and retrospective, i.e. childhood behaviours. A lot of neurodivergent people can kind of go blank and go into freeze mode when put on the spot in stressful situations, which is part of the reason I want to talk about what kind of questions are actually asked and provide a link to the actual form that your assessor may use in this video description to hopefully help people think and reflect about things in advance, not to quote-unquote cheat. It always absolutely baffles me when people think getting an ADHD diagnosis is somehow cool, but yeah, to help you honestly reflect on whether you're meeting some or a lot of these criteria and whether a formal diagnosis is something you'd be interested in pursuing. The assessors will also ask for any additional material from childhood which may indicate ADHD traits. And I still had a lot of my old school report cards, which I've mentioned before, which were really helpful and pretty much ticked off every single aspect of inattentive ADHD, which would surely, hopefully, be picked up and addressed now, but wasn't back then. In my case, the school reports were enough evidence of childhood struggles to not warrant follow-up interviews with people who knew me as a child, which was kind of useful because my parents on their form essentially said I didn't struggle with any of the things that I said I did or that my teachers had said I did. I think they were kind of in denial a bit, or just didn't really want to think that I'd been struggling, because I broadly managed to get good grades, even though I really struggled to study or focus on my schoolwork, and I was off sick a lot as a kid. Some providers prefer to interview parents or family members in person in addition to the individual as part of their assessment. If that's not something you want, have those discussions beforehand with the provider and check if they're happy with other routes. There can be more flexibility with this than maybe initially seems apparent. Just talk to them and have a conversation. The first thing to say about the DIVA assessment is that it's literally a tick box exercise, like I said, I'll post a link in the description to the actual form that clinicians go through, ask you about and mark up as the interview progresses. If you recognise and can describe situations where the challenges described on the form were present, if the clinician's not sure or wants more detail, they'll probe and explore a bit, so just be honest about your struggles. You probably won't have been affected by every challenge listed, but the clinicians assess whether enough symptoms are present to warrant a diagnosis. So the DIVA's divided up into 3 sections. The first being symptoms of inattentive ADHD, the second being symptoms of hyperactive-impulsive ADHD, both of which have 9 questions, where you must be assessed to have suffered impairments in at least 6 of the 9 areas. And if you check off 6 or more in both categories, as I did, you get assessed as having combined inattentive and hyperactive-impulsive ADHD. And the third category is assessing age of onset and extent of impairment. For example, whether ADHD challenges have affected you in a range of situations, from school to work to relationships, family situations, self-esteem, self-confidence. I'm not going to go through every example of every question because there are multiple examples under every question for both adult behaviours and childhood behaviours. But if you're considering whether you may have ADHD or not, and especially if you're preparing for an assessment, I'd urge you to spend time with the test, with the form, and consider all of the examples in detail and whether these were things that affected you or not. But what I will do is give a very brief run through of the 9 key questions in each of the first 2 sections, so 18 questions overall that the clinician will go through. So the 9 questions for inattentive ADHD, all of which look for examples in both adult and childhood, are: 1. Do you often fail to give close attention to detail or make careless mistakes in your work or other activities? I talked last time about how co-occurring autism can often mask some ADHD traits, and I was glad to see in the additional examples listed under this question to help the clinician. It also notes, or works slowly to avoid mistakes. I would say I don't often make mistakes, but I do work incredibly slowly to avoid doing so, and can often get bogged down in detail. Others just work very quickly and impatiently, and often don't take in all the information, which is more classically ADHD, but it's nuanced. So I was glad to see that reflected. Question 2. Do you often find it difficult to sustain your attention on tasks, with examples being easily distracted from tasks by your own thoughts and associations, unless the task is exceptionally interesting to you, and difficulty with finishing films or books once you've started? Question 3. Does it often seem as if you're not listening when spoken to directly? So difficulties concentrating on conversations, thoughts drifting off, having to have things repeated. I wouldn't necessarily describe myself like this, but I've had multiple bits of feedback throughout my life that I've not paid attention to things I should have been paying attention to, which I think happens to a lot of us. Question 4, do you often fail to follow through on instructions, complete tasks, or fail to finish jobs or meet obligations at work? Yep. Question 5, do you often find it difficult to organise tasks and activities? Yep, again. Additional examples being, do you often misjudge time and run late for things, create schedules but fail to use them well, rely on others for structure, complete tasks in a muddled, disorganised way? Question 6. Do you often avoid tasks which require sustained mental effort? I am awful with this. Demand avoidance, like I said, is real. So I will always put off difficult or boring tasks until the last possible minute, to the extent of complete task paralysis and inability to initiate or start things if they're not urgent. Even things I want to do, like reading long articles or listening to educational podcasts, or manage to record one of these videos for months on end. It's always just later. If there's something easier or less taxing I can do first. And I massively frustrate myself and just don't get done the things I want to do. Question 7. Do you often lose things that are needed for certain tasks or activities? So are you often leaving things behind or forgetting what you'll need, or losing or mislaying things? Question 8. Are you often easily distracted by external stimuli? So find it hard to pick up the thread again of something you've been working on if you get distracted. Also difficulty filtering and selecting the most relevant information. And easily distracted by outside noises. So again, yup for all me. And question 9 for inattentive, are you often forgetful during daily activities? So need frequent reminders to stay on track, rigid use of lists to make sure you don't forget to do things. I've talked about this previously. It was one of the reasons I didn't initially feel I fit the bill for ADHD, because I do remember appointments and obligations, but only because I learned to live my life off a spreadsheet after being an absolute shit show in my teens and 20s. So yeah, that's part one of the formal assessment. If 6 or more of those 9 are ringing bells for you, you may well have inattentive ADHD. Part 2 of the DIVA assessment focuses on hyperactive-impulsive ADHD. And those questions are: 1, do you often move your hands or feet in a restless manner or fidget in your chair? So leg fidgeting, pen tapping, hair twirling, nail biting, difficulty sitting still. 2, do you often stand up in situations where the expectation is you remain seated? So this is one I absolutely don't do. In the privacy of home, sure, but in an office or in public, like, no way. I was always too focused on not standing out and masking and trying to come across as normal. So that was a no for me. 3, do you often feel restless? So constantly having a feeling you should be doing something, finding it hard to relax, just feeling sort of restless or agitated inside. 4, do you find it difficult to engage in quiet leisure activities? So feeling a constant need to talk even when it's not appropriate. Again, this isn't so much me, although I will overtalk if I'm feeling nervous, but I can definitely stay quiet for very long periods. So again, this one was a no for me. 5, are you often on the go as if driven by a motor? Kind of similar to question 3, but always busy doing something, find it difficult to let things go, feel a need to be constantly busy. 6, do you often talk excessively? Again, this is kind of similar to question 4, but more pointed, I guess. Are you known as an excessive talker to the extent other people can find it tiring? Do you sometimes find it difficult to stop talking? Feel you need a lot of words to say something quite simple? Don't always give others the chance to interject in a conversation. Again, I know people like this, but I don't think this is me. Going through this again, I'm actually kind of surprised my diagnosis was combined rather than just inattentive. I feel like I'm a lot more the first type. Anyway, 7, do you often give the answer before questions have been completed? I do this. I'll complete other people's words and sentences, and I've been told it's annoying. I think I do it to show I'm listening and relating, but I'll quite often misguess what they were going to say, so fail. 8, do you often find it difficult to wait your turn? So similar, but yeah, this one's more difficulties waiting in queues or waiting in line, waiting in traffic jams, feeling impatient and frustrated when forced to wait. So also, patterns of impulsivity ending or leaving jobs or relationships because you get impatient or frustrated. So, yeah, more impulsive traits. And yeah, probably swinging back towards me again. And question 9, do you often interrupt the activities of others? So have a tendency to interfere, interrupt, feel the need to express opinions even when not asked, and have difficulty respecting others' boundaries. So yeah, again, if 6 or more of these 9 aspects sound like you may well win the prize for hyperactive/impulsive ADHD diagnosis. And again, 6 or more from each section, you may well have combined ADHD. The final section of the formal assessment is an assessment from the clinician of whether there's enough evidence of whether the symptoms and challenges discussed have been present since childhood and throughout your life in a range of circumstances, in your home life as well as your school or work life. So difficulties with housekeeping and admin, relationship problems as a result of symptoms, frequent arguments, difficulties in social situations and sustaining friendships, inability to fully relax during free time, impulsive binge eating, getting interested in new hobbies or fixations, then quickly losing interest, dopamine chasing, basically. Negative self-image, rejection sensitivity, intense reactions to criticism, fear of failure, perfectionism limiting your achievements. And all this feeds into your final assessment. I had my assessment over the course of two 90-minute sessions, which doesn't sound like a long time. It's 3 hours to make a hugely important judgment on someone's brain wiring. But actually, in many ways, ADHD is, at least in my opinion, easier to assess than autism spectrum. Again, just in my opinion, autism I'm not sure can be accurately assessed over 2 to 3 hours. We touched on this in the video I did on the ADOS. Particularly when excessive masking has been learned over time, and I believe often needs more time with someone to fully self-reflect. But I genuinely think when someone's ADHD, you can broadly get a feel for that pretty quickly by the way they talk, by the way their mind works and kind of free associates. You just need to know what you're looking for. And a couple of years ago, I would have had no idea whether someone I was talking to was ADHD or not. Now, I quite often find I've identified whether someone's ADHD or not within just a few minutes of meeting them. Whether that's accurate or not, I don't know. I don't formally test and assess everyone I meet, but I do strongly think having greater awareness of this is to everyone's benefit, not least to be more accommodating to help people with ADHD get the best out of themselves and their awesome brains, and not be boxed into roles and situations that shred us, as is so often the case. And yet, for me, I got the diagnosis pretty much immediately, or at least within a couple of days, and had a follow-up call and was prescribed medication to titrate within a couple of weeks of having the assessment. It was really speedy, and as I've indicated in previous videos, the ADHD meds didn't hugely work for me, probably because of the co-occurring autism, but they do work for a huge number of people, so I'm all for people trying to see whether meds work for them or not. Anyway, right, that's broadly going to be it for the sort of just ADHD videos I want to do, I think. For the last few videos in this series, which I'm going to get done, I'm going to get back more to autism again, and particularly the autism ADHD interplay. So yeah, thanks again for watching. Thanks again to everyone who messaged me during my very long gap between videos to check that I'm alright. I wasn't alright for a little while there, but I am again, and I'm feeling alright. And I really do appreciate the messages I got while I was away. So yeah, cheers and see you next time. Thanks.